left internal mammary artery, or the lima as we abbreviate it, remains the gold standard blood vessel for use in bypass surgery ever since it was first discovered in 1950, so over 70 years ago. And mostly it's because of its longevity, and we believe the durability is partially a result of a special group of extracellular vesicles, known as exosomes, that are released by the cells lining the lima that protect it from developing atherosclerosis, making it such a good conduit for bypass surgery. My name is Ilya Shadrin. I'm an MD PhD, and I did my residency at Mayo Clinic, and I'm currently a second-year fellow in cardiovascular disease at Duke University Hospital. I'm delighted to present to you our review, which is entitled Left Internal Mammary Artery as an Endocrine Organ, Insights into Graft Biology and Long-Term Impact Following CABG, which will be published in the January 2023 edition of Mayo Clinic Proceedings. In our review, we do summarize numerous reports that compare the lima with other arterial and venous conduits that are used for bypass surgery. We identify potential alternatives to the preferred vessel. These include vessels such as the gastroepiploic artery, the radial artery, and the saphenous venous graft, which are most commonly used as well. We provide an overview of the mechanisms that we think account for the different longevity of these grafts. And we look at the different proteins and genes that are differentially expressed across the lima and the commonly used venous grafts. Moreover, other studies that we've looked at have identified extracellular vesicles, as I mentioned earlier, known as exosomes, which contain proteins and microRNAs, many of which have been implicated in vasodilation, scavenging of free radicals, reduction of proliferation of smooth muscle cells, among other mechanisms. Collectively, we think that these data suggest that the lima derives its longevity in part from a unique set of exosomes that create an anti-inflammatory phenotype, protecting it from the development of atherosclerosis. These findings are important for clinical practice because it suggests that the lima, as we already understood, and other arterial conduits for CABG, and opens the doors for synthetically created lima analogs, which can replicate some of the features used within the lima in a more synthetic application. For patients, this means that bypass surgery is almost always done using at least one lima graft. And furthermore, if further research is able to create lima analogs that have similar features as the native vessel, it will greatly improve the ability to revascularize large areas of heart tissue. We are hoping to directly compare the exosome contests derived from cells lining the lima versus the saphenous veins. Ultimately, if we can find a unique lima exosome milieu that can be identified and harvested in lab, these can be further incorporated into synthetic grafts that expand the revascularization capability of traditional bypass operations. We invite our readers to look at the details presented within our review, specifically the table and the graphical abstract that highlights some of these central mechanisms that I discussed that we think leads the exosomes to be the central part against the anti-inflammatory and anti-atherosclerotic phenotype of the lima.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.